Hi, everyone. I'm Dr. Annie Savage. I'm a naturopathic doctor working out of Vancouver, British Columbia. Today, by the end of this video, I want you to know what a naturopathic doctor is, how they're trained, and how we work. At my office, we've helped hundreds of thousands of women get better, reach their health goals, and we want to bring that information to everybody. So we've started this YouTube channel. Let's jump in. All right, to become a naturopathic doctor, you need to have a 4-year undergraduate degree completed. Most people do a science type degree because that's what you need for those prerequisites to get into naturopathic medical school. Then you apply for your naturopathic medical program. There are schools in Canada and in the States. The two in Canada actually just joined forces. So now there's one in Canada, but it has 2 locations out here in Vancouver. It's actually in New West, British Columbia. And then the other one is in Toronto, Ontario. So your application process to get into naturopathic medical school does not include an MCAT. So there's no standardized test, but there is writing those letters, having the interview process and mentorship from previous students. When I went, it was a full day interview. I can't really remember it all. It was a tour of the school, meeting some students. I think they actually asked some questions as well. And then I believe there were 4 professors and doctors that did all the questioning. Once you begin your naturopathic program, what you learn in the first 2 years is basic sciences. So you're learning embryology, physiology, biochemistry, all of those basic science programs that you also learn in our conventional medical school programs. After the first 2 years is complete, you do your first set of board exams. It's called an NCLEX exam. Again, this test is very similar to the one that our conventional medical doctor friends take. We actually use their study materials, the USMLE books, so we could study together technically for that exam. That board exam is an 8-hour exam. It's not very fun, but you get through it, and then you enter your 3rd year. In 3rd year of school, that's where the 2 programs kind of differ. You have the conventional model and then the naturopathic model. So in the naturopathic model, in that 3rd year, you start to see patients in the clinic. So you're a student clinician. We also begin to learn all of the different modalities that we're able to use as naturopathic doctors. So we do traditional Chinese medicine for a full year. We have the theory and the practicum. Class time as well as lab time when we're actually poking each other with needles, poking ourselves with needles. We also learn chiropractic adjustments. So that's the physical medicine portion. That would be your manual therapy, just like a chiropractor would be learning as well. We do a full year of the nutrition programs. We do loads and loads of nutrition, exercise, diet, and lifestyle kind of learning. We also learn botanical medicine, where we can use all different kinds of herbs. And then we also have a pharmacy class. We learn all of our pharmaceuticals. After your 4th year of naturopathic medical school, you graduate. Yay! But you have another board exam. This exam is 4 to 5 days long, depending where you're going to practice. So when you finish school, you graduate, which is fantastic, but then you have your big board exam in the following couple of months. So that board exam, again, looks very similar to our conventional medical doctor friends. We study in a similar way. It's case-based. And then I believe there are 4 to 5 questions pertaining to each case that would test your knowledge on different aspects of how you're going to treat and the safety of what you're going to do for that treatment. That exam is 2 full days. Portions of it are the minor surgery section as well as the acupuncture section are separate. And then depending which state or province you're going to practice in, you also have to do their licensing exam. So that is your jurisprudence exam, knowing the bylaws that you have to work within, knowing your rights or non-rights. So in BC, we have another set of practical exams. That was a full day as well. And then another set of board exams to have our pharmacy license. After all of that, 8 to 9 years of school, 2 sets of board exams, another set of your jurisprudence exams, you become a naturopathic doctor. And you get to treat people and help them feel better every single day. One of the main principles that we work with in naturopathic medicine is seeing the person as a whole, or looking at the body as a whole. So typically we aren't looking at a symptom and treating based off the symptom. We want to get a whole picture of symptoms, everything that you're dealing with, and then figure out what is causing those symptoms. There may be 1 or 2 things causing those symptoms, but we want to figure that out so that we're treating the root cause and not just slapping a Band-Aid on top of the symptom. We know that symptoms are messages from our body. So something hurting, something not right is our body saying, hey, we need a little more help here. You're doing something that we really can't handle. So that's how we want to look at the body and really get that true healing. Thanks so much for watching all the way to the end. If you like this information and want more information about how we work with our patients, please like this video and subscribe below.